What's up, guys? It's Dr. DJ Haskins, physical therapist and owner of Resolo Health and Performance here in Tampa Bay, located inside of Cooper Performance. We are going to be talking today about acute injuries and what you should be doing to manage them. So you just sprained your ankle, or you just strained your shoulder, or you sprained your knee, whatever the case may be. Today we're talking about what you should be doing when that happens. If you've been around for some time, depending on how old you are when you're watching this video, you may have heard of the RICE method, right? Rest, ice, compression, elevation, and that's pretty popular. But we're going to talk today about why that R part, the rest, is where we need to be really paying close attention. So unless you've fractured or you completely tore the muscle that you strained, we want to get that thing moving early on, right? So if you sprained your ankle, don't just go throw it in an immobilizer and lay up on a couch for days on end. As soon as you can tolerate, not pushing into a lot of pain, get that ankle moving. If it's your shoulder, get that shoulder moving. If it's your back, get that back moving. What that looks like is different for each person. So it really depends, and that's where maybe you should consult a rehab professional, or come see us here at Resolo Health and Performance in person, where we'll be happy to take care of you. But then the other part, ice. Should you be icing? It's questionable. I'll link actually a study to this video down in the caption below, on something that you should read and whether or not you should be icing, because it's going to be really dependent person to person. But the understanding now is that it can actually slow down the healing process. But the big thing, if you had a sprained ankle or if you had a sprained knee, especially, is getting some compression on there, right? You can find a little knee sleeve or a compression sock to really help the ankle out and get some of that swelling out of there. And then the elevation, getting that leg elevated, getting the hand elevated, whatever it might be, so that way gravity can help get any of those fluids out of there and things can get feeling better. But the main takeaway is early movement. If you sprained your knee, get that thing bending, get it straightening as far as you can, as soon as you can, and make sure that you talk to a physical therapist or rehab professional that can help you and give you an exact game plan on how to get back in action.